I am going to pass the mic, the virtual mic, to Phyllis, who is going to do a land acknowledgement before we dive into the report out of the 5-year prevention plan. So Phyllis, I'm passing it to you.
Good afternoon, everyone. I want to acknowledge that the state of Washington was built on the traditional lands and sacred homelands of more than 29 federally recognized tribes and 3 non-federally recognized tribes. Please join us in honoring the traditional tribal land where you reside. Although each tribe is unique, they also share some similarities. Historically, tribes have relied on fishing as their main source of food, as well as hunting, among others, elk, deer, and bear. The 5 species of ocean-going salmon native to this area are especially important for the Coast Salish people. Berries such as huckleberries were gathered in the high country and were pounded into cakes for drying. Strips of cedar bark were harvested from huge standing trees in the spring, and when it could be pulled away easily for later use in clothing and baskets. We pay our respect to the tribal elders, both past and present, as well as all Indigenous people today. We are honored and grateful to be here on their traditional lands. With this tribal acknowledgement, we open our time together by honoring the ancestors whose feet first knew these lands, whose paddles still know the waters of what we now call the state of Washington.
Thank you, Phyllis. All right. So, why are we all here today? Why are we in this virtual room, and what are we going to learn? So, currently, the information that we are here to present to you is that the Washington 5-year prevention plan is expiring. It goes from 2020 to 2024. And so, Washington has really been making active efforts to engage individuals and community members across the 6 regions that we talked about earlier, as well as conducting 4 virtual town hall sessions that were held throughout the month of September and October. At the end of this presentation, we're also going to give you some information that you can engage and provide some feedback and input on the information that was shared with you today that may still be included in the 5-year plan that they are working to develop. So um, there are opportunities outside of not just today, but outside of today that you can provide information and input. And so your role really today is to be an active listener, to provide and sorry, puppy distraction. The overview of suggestions that was learned during the community engagement sessions. And then we do really strongly encourage you to use the Q&A function, and that may be at the top of your screen or the bottom of the screen, depending on how you joined Zoom today. And ask any questions that you may have. We do have enough folks on the call today that are going to provide answers in real time for you, as well as if there are questions that aren't able to be answered, they're going to take those back and be able to provide information outside of today. So we do actually have a question. We have a poll that Katie is going to launch for us today. The question is, and you'll see it when it pops up on the screen, is did you participate in a town hall collaboration forum or other type of engagement session? So were you able to either join virtually or one of those in-person sessions that happened across the state? Hey, looks like the majority of folks on this presentation, about 75% were not able to participate in any of those engagement efforts, either virtually or in person, and about 27% of you were able to engage in the session. Okay, that lets us know what kind of information or questions you may be asking today, and kind of prepares the team of what to be ready for as they're looking to respond in that Q&A. So that's exciting. And it's also exciting to know that this is maybe the first time you're hearing this information, but it is not the only time that you have to offer input and contribute to the development of the prevention plan that will be submitted to the Children's Bureau at the end of this calendar year. So, all right. I think I'm going to close it, but it looks like we're at 27 to 73% for the majority of folks have not participated or been able to participate in an engagement session. So we're excited to have you and excited to hear what input you have from our conversation today. All right. Oh, did I share the results? Did it show up? All right. Gonna exit out of that. All right, I'm going to pass it to Maureen now, who's going to talk to you about some history of the Family First Prevention Act and walk us through some other information. So there you go, Maureen.
Yeah, thank you, Sarah. So good afternoon, everybody. Um, Given the results of the poll, I'm going to just preface this by saying I might move a little bit fast through some of the background information, um, some of the, you know, the law pieces, because I know we really want to focus on more of the engagement and where we're going with this at this point. That said, if there are specific questions about any of the details about what Title 4E is, or what really we can or can't do in our prevention plan according to federal guidance, please feel free to drop those in the Q&A. As Sarah mentioned, we'll have some folks monitoring that throughout the presentation today. So just to get started, very basic, the Family First Prevention Services Act, which you will see in the presentation and you will hear me and others refer to as FFPSA or sometimes just Family First. That was an act that was passed and became law in 2018. And while acknowledging the imperfections in the law, um, FFPSA has really given states and tribes more resources to keep children with their parents and kin caretakers at home and to prevent the need for out-of-home care or foster care whenever it's safe to do so. And so that is what we're really excited about. There are several other provisions within FFPSA that talk about some different aspects of child welfare, but what we are really talking about today is the prevention. So we're talking about foster care prevention. What can we do to help keep kids with their families? This is probably the first major piece of legislation that allows states and tribes to receive reimbursement from the federal Title 4E funding source for certain foster care prevention services provided to eligible children and families. And so I'm saying that knowing that there are other prevention programs that Washington uses or that other states have implemented that are not funded through Title 4E, but may have, been implemented using, Medicaid dollars, for example, or other grants. So these are not the only prevention services that are available. These are the ones that we're talking about. Today, we're talking about the ones that are funded through Title 4E as a result of FFPSA. So what is Title 4E? Title 4E is part of the Social Security Act. Sarah, can you drop back just one slide? Yeah, perfect. So it's part of the Social Security Act, and it authorizes the federal government to provide states and tribes reimbursement for certain child welfare costs. If you look at the slide on the left part of your slide, you'll see a list of programs that states and tribes have historically been able to request reimbursement for from the federal government. And you might notice that all of those programs on the left, foster care, adoption, guardianship, are all for after there's been a substantiated claim of abuse or neglect and the child has already been removed from their home. Family First gives us the opportunity to use Title 4E funding before a child is separated from their family. And so Family First really aligns with the research that we've been seeing. I don't think that this is probably new to anybody. We have decades of research at this point, but a child separated from their family is not going to have as good of outcomes, generally speaking, as a child who's able to stay with their family. So we really want to do what we can to keep families together. It also really supports a partnership between families and um, whatever the Department of, Social Services is in a state or a tribe. So in Washington, DCYF, um, really focuses more on partnership and giving families some more control to choose the path forward that they think is the best to keep their children safe and well. Under FFPSA, the federal government will reimburse states and tribes for certain evidence-based practices, excuse me, provided to eligible children and their parents or kin caretakers. So this is not like a universal funding opportunity. It's very specific to certain types of services and certain populations. And it's also important to remember that unlike some other grants that you may work with or have heard of, where an agency is given funds with certain guidelines and then they can spend those funds, Title 40 is a reimbursement-based grant. So that means that every dollar the state or tribe spends on allowable expenditures, the federal government will reimburse a portion of that dollar or might reimburse a portion of that dollar. So usually it's between 50%, 75%. It might be based on a different formula. But I say that just because we want to keep in mind that it means states really have to do investing up front. So, the state or tribal government has to be willing to spend funds up front and make initial investments because they're not getting this money right away. They're not getting this money from the federal government up front, and they're only getting a portion of their costs reimbursed. So that's just to put a little framework around it as we move forward. So then on the next slide, we're going to talk about the 5-year Title 40 prevention plan, which Sarah mentioned earlier, which is why we're here today. So before a state or a tribe can begin claiming Title 40 for prevention services, the Federal Children's Bureau, which is part of the Administration for Children and Families in Washington, D.C., requires the state or tribal Title 40 agency, excuse me, to have an approved 5-year prevention plan. So the Title 40 prevention plan details how the state or tribe will implement and manage the FFPSA requirements. And the plan is pretty long. I don't know if anybody on the call today, besides folks who work at DCYF, have looked at a full prevention plan, but there's a lot that it covers. And so we've been doing a lot of work to make sure we're covering all of the bases that need to go into this next 5-year plan. So things that are in the plan. Who is eligible to receive services? What services will be provided under FFPSA? How will each one of those services improve specific outcomes for children and families? Talks about evaluation. So how will the state evaluate each prevention program and service? How is the state going to ensure that children remain safe when they're at home with their families? And who and how will DCYF consult and coordinate with other state agencies, community-based organizations, and other partners? There are some more things, but I'm going to stop reading my bullets at that point. The purpose of creating a new prevention plan, first, it's required. So it's 5 years. Washington was one of the first states to submit an initial Title 40 prevention plan. That plan was approved back in September of 2020. And since then, DCYF has utilized that plan to strengthen efforts to support children remaining safely with their families. And now it's time for us to do a new 5-year plan because our current plan will be expiring at the end of 2024. So we'll need to have our new 5-year plan ready to submit before the new year. So as we know, a lot can happen in 5 years. So if you think back to what you were doing or what you thought you knew 5 years ago, there have probably been some significant changes. In general, things don't move quite that quickly in government, as they do in our personal lives, but there have still been some pretty substantial changes and additions to the federal guidance. Ever since FFPSA became law, people across the country, across sectors, governments, community organizations, caregivers, um, people involved in child welfare, across the board have been pretty loud and clear about the need and desire for families to be able to access services in their communities without needing to be directly involved with the traditional state or tribal child welfare system. So this is something that the federal government has acknowledged, and one of the biggest changes that they have worked through over the last few years is figuring out how to allow and support states and tribes in expanding their community-based opportunities. And Jillian, who waved at you earlier, will talk more about that later. And then another thing is that we've gotten more guidance recently, even as late as like July of this year, about tribal service opportunities. So for example, in the past, um, tribes that have direct Title 40 agreements with the federal government have had a little bit more flexibility, and they've had more opportunities to build out their own prevention services and plans. And recently, there's been some more flexibility given to states that have agreements with their state partners and not needing to go to the federal government. So that is a pretty significant change as well. And I'm just going to pause here really quickly to see, I don't have my screen up. Do we have any Q&A? Just gonna do a
Not yet,
quick.
Maureen. We're good.
Okay. All right. Perfect. All right. So as we are building out our new 5-year plan, we want to make sure that we're capitalizing on some of the different opportunities that we have to strengthen Washington's prevention program. So we've got some things listed on the screen here. We talked about a couple examples, or I did on the previous screen, but we want to look into expanding the candidacy definition based on what's happening in Washington and also some national trends. Candidacy is how the federal government refers to eligibility. So I'll say candidacy is like eligibility. So for a state or tribe to be eligible to receive Title 40 reimbursement, prevention services have to be provided to a candidate for foster care. Can you see my air quote? Yeah, okay. Candidate for foster care, or their parent or kin caretaker. So we want to take a look at who's in our candidacy definition, who are our eligible populations. And then additionally, I think I said this earlier, but Washington was one of the first states to lay out in their Title 40 prevention plan a goal of expanding service delivery into the community and not only offering prevention services through DCYF. So as part of the new prevention plan, we have the opportunity to take a look at and potentially expand Title 40 reimbursement to community-based providers via a community-based pathway. Again, Jillian will talk more about that a few slides from now. And then we can also include in our prevention plan our services specific to tribes, and those can be accessed via tribal Title 40 agreements with DCYF. So we definitely want to take a look at that. And then another example is that we have more opportunity now to focus on addressing disproportionality amongst our BIPOC populations. Okay, so on the next slide, I'm going to just take a little step back. So we've been talking a lot about prevention, and we know Sarah, I just saw your face pop up on my screen. Is there a question?
There is.
Okay,
There's a
perfect.
question about reimbursement and availability. And I'll let you answer that one first. And I think it may be good to speak to this question, Maureen. Is there a list of reimbursements available, such as programs and amounts? Given that we have a large group of folks who don't have a lot of Family First information, it may be a little bit to lay some groundwork for that at a high level. And I know that the team is also typing an answer at the same time.
Okay, yeah, I will let some answers flow into the Q&A so that folks can see them. But really quickly, so reimbursements available when we're talking about the Title IV prevention um, program, we're talking about very specific services and very specific eligibility requirements. So I'm not sure, it looks like, Melissa, you asked this question. If you have more specific details about your question, please feel free to drop them in the chat. But there aren't specific amounts tied to these services and programs. There is a list of services, which I'm going to speak to. Again, I'm not positive if this was exactly your question, but there are evidence-based services. There's a clearinghouse online that's run by the federal government, the Title IV Prevention Services Clearinghouse, and that lists all of the services, which I will talk about in another minute. And I know Phyllis is typing an answer to that question too, Melissa. So we can circle back to that one if I've missed the mark there.
Yes, sorry, I can come off
Oh, perfect.
mute.
Perfect. Yeah.
Sorry, I was trying to find the words. I will turn on my camera as well. So Melissa, we are currently in the process of the short answer is no. We don't have a specific list of services that have like a reimbursement rate, similar to what you might see for an insurance company when you're providing individual specific services. Part of this process is that we are identifying what those services could and would look like. And then there's an additional process behind the scenes, which then identifies what I'll say the rates in which we can look at being reimbursed by the feds would be. So the short answer, no. The long answer is that we're working on them, and any of those rates would be an exchange back and forth between the department and the feds in relation to reimbursement. I would also say in terms of the teen dating violence prevention, again, part of the sessions that we had were to identify the kinds of services that folks looked at needing in community. We are, and I'm not sure if we talked about this quite yet, but there are a list of services, EBPs identified that are on the clearinghouse. Those are the ones that we need to use for our claiming and reimbursement. 50% of those have to be at least well supported. And so if we don't have anything specific to dating violence prevention, it's because it's not on the clearinghouse and maybe didn't lift up into that well supported or supported criteria.
And you're right, Phyllis, we haven't talked about that. We'll talk about, we have a slide that will articulate what the current list of services are in the existing plan, and then what some of the suggested are that they heard from feedback across the state. So I'm going to keep us moving and Maureen, let you talk to the levels of prevention as we work to answer questions in the chat. And if we see some repetitive ones, we'll definitely address those.
All right. Perfect. Great. Thank you, Sarah and Phyllis. Appreciate that. Okay, so stepping back to just talk a little bit about what we mean when we're talking about prevention in relation to FFPSA. We kind of have to keep in mind that some types of prevention are in scope and some are out of scope. So in this context of Family First, in this context of just child welfare, the three levels of prevention that we could talk about are primary, which sometimes we also call universal, and that's, services aimed broadly at the general population. It could be public awareness campaigns about the scope and effects of child maltreatment, parenting classes. It could be efforts to educate children about safety. Secondary prevention, which is more services like the home visiting programs, parenting classes, or respite care that are targeted to populations at a higher risk of maltreatment. And then tertiary prevention includes services for families that are already affected by maltreatment. So family preservation services, parent mentoring, support groups, mental health services. And FFPSA is really targeted toward providing secondary and tertiary prevention. Although, again, acknowledging that there is definitely a need to continue pushing for more services upstream. So then also when we're talking about prevention services, the services have to be eligible for Title IV-E reimbursement. And right now we're limited to certain types of evidence-based programs. So the EBPs that we are looking at right now, or that are eligible for reimbursement right now, they have to be rated on the Title IV-E Prevention Services Clearinghouse that I just mentioned. And they have to be rated as either having well-supported, they either have to be well-supported by evidence, supported by evidence, or a promising practice. And then also they need to fall into one of these three areas that are up on the screen. So it has to focus on either mental health, substance use, in-home, parenting skills, or a combination. So there are several services on the clearinghouse that are cross-cutting that, work in two or three areas as well. And some are, of course, only one. And then the other thing I just wanted to note here is that states and tribes can continue to recommend services to be reviewed by the clearinghouse. I'm sure there's like a pretty significant backlog at this point, since we're, 6 years into the law being passed. However, we do have that ability. So we've seen certain states and tribes put forth services that they want the clearinghouse to review and rate. Some of them end up becoming rated, some of them are not rated. There's just not the evidence base. But it's certainly worthwhile to think through if there are services in your communities that you think are working really well that we might be able to get some evidence behind. Those are things that we want to hear about. Okay, I am almost done talking, I swear. Okay, so you may be asking yourself, what services are currently in our approved prevention plan? So the list of services that are in the plan right now are up on the screen here. So functional family therapy, motivational interviewing, multisystemic therapy or MST, nurse-family partnership, parents as teachers, home builders, safe care, child-parent psychotherapy. As we're going through thinking about other services to include in the plan, I just want to say that these services aren't going anywhere. So these are going to stay in the plan and we're going to look at supplementing them. So you'll still continue to see these. So on the following slide, Jillian, not me, you will get to stop hearing me. We'll walk through some of the suggested additions that we've heard from our community engagement sessions.
All right. I think I'm hooked up. We're good?
Yep.
All
Yep.
right.
Can hear you.
Wonderful. Um, Thank you, Maureen, for giving that high level overview of Title IV-E and the prevention plan. So I just wanted to kind of, highlight that now this slide is really shifting from just the general information about Title IV-E to what we have been learning as we have been engaging community. So as we've been engaging the community over the last 2 months regarding the drafting of our new Title IV-E plan, we have been getting feedback through participation in our community forums, participation in our virtual webinars or town halls, and then also participation and feedback through just the website where we have feedback. We have a feedback portal for general information to come back and forth, as well as our Family First Act email where we've been getting information collected. So what you see on your screen is a result of a lot of that collective information. So I do want to highlight that by no means is there an order based on the priorities here. But what we did recognize as we were discussing things in community is that there is definitely a need for more services that are responsive to mental health for both children and youth and also caregivers, as well as SUD, so substance use disorder treatment services, definitely a need. And then as we were in different regions, it was highlighted that really having more options that are culturally responsive was necessary. And then from the last slide, you'll also notice there was a lot of these services that are in our current plan do address different age ranges. However, there was a lot of feedback that talked about having an increased amount of services that really met that adolescent population. So I just wanted to highlight a few of these that are up on the screen as we kind of discuss. Some of these were listed through, again, priority ranking during activities. Some of this was due to the fact that the Department of Children, Youth, and Families also already is contracting for some of these services. So for the triple P that you see listed, that stands for Positive Parenting Program, which is a mental health and a parent skills-based service. That is one that is currently being contracted by the department that really meets the age range for those from 2 to 18 when they're as a parenting intervention for families with concerns about their children's moderate to severe behavioral health problem. So a priority there in kind of ages and the availability of the service. Promoting first relationships, incredible years, and the parent-child interaction therapy are again all contracted services we do have available through DCYF in our combined in-home services, but they were not part of our last prevention plan. And as Maureen did mention earlier, Washington was really one of the very first states to submit a prevention plan. And by doing so, the clearinghouse hadn't rated as many services as they have had rated at this point today. So the inclusion of those additional services. I did mention that mental health and SUD are definitely priority as we talked to communities, and there was that emphasis to look at services that could meet that population of individuals. So DBT, dialect behavioral therapy, which is a cognitive behavioral treatment service that's provided by mental health clinicians, was definitely suggested, as well as sobriety treatment and recovery team, that service that's the acronym is START. And then lastly, I wanted to emphasize on this slide, the Washington Kinship Navigator Program. As part of the Family First Act, you can apply for reimbursement for Kinship Navigator programs. This is a separate little segment of the FFPSA or Family First Act that doesn't necessarily have to be listed as a service like the other EBPs, but does have to be clearinghouse rated in order to receive federal reimbursement for. Highlighting that it was just in the last 1 or 2 months, Washington received a rating of supported for their Kinship Navigator program. And so now with this upcoming plan, that program will be reimbursed through Title IV funds, which is definitely exciting. As we did go through in community about all of this, there was a lot of questions regarding, who can provide these services and what are the educational requirements needed to do so. And so I did want to say we are working on putting together a document, a public document that will have that higher level of information. But all of that information can also be found on the clearinghouse link that I did put into the Q&A just a moment ago when there was a question about services. And then also for that Kinship Navigator program, I did want to highlight that for that is definitely just the lived experience as a kinship caregiver or experience working with kinship caregivers as that requirement in order to be a kinship navigator. So again, this is just a high level overview. We did receive other feedback. What our team now is doing is really analyzing what can be added to our plan in alignment with what the community is really looking for and needs. And in a later slide, we'll talk a little bit more about what those requirements are. So I'll go to the next slide, which talks a little bit more about the flexibilities when we are looking at the ability to include culturally responsive services that are not in the clearinghouse as a flexibility for those tribes with the Title IV-E agreement. We do have a tribal specific listening session that we will be hosting on October 28th that goes into further detail around some of these options, but I did want to highlight a few of them here today. Family spirit was one that was brought to our attention, as well as healing of the canoe, family circle, and positive Indian parenting when we were submitting our last plan. At that time, the clearinghouse had not rated any tribal specific services as being able to receive reimbursement because they did not meet the level of well-supported, supported, or promising. But since then, Family Spirit has received an approval rating of promising, which is very exciting that is available and available outside of just those Title IV-E agreements. The rest, these other four, or excuse me, 3 out of those 4 were other services that were identified through that evidential review that was done by the University of Washington and recommended that would be funded through Title IV-E in the future, in which we are working towards drafting those in, as well as the identification of tribal family preservation, and then also the Kinship Navigator program that could be expanded with now receiving a Washington Kinship Navigator program approval. At the listening session on the 28th, we are going to be going over some additional best practices and looking at how we can partner with tribes who are interested in expanding their prevention program through a Title IV-E agreement and what we can do to draft certain language within the plan as in those categories. And we'll go to an additional theme that was definitely reoccurring as we were working and engaging with community that I wanted to highlight and emphasize today. And that is that really culture is prevention and that concrete goods and supports are truly prevention. And really emphasizing the importance of braiding these services and supports together as much as we can through a variety of different opportunities. Culture plays a critical role in preventing child welfare involvement by promoting culturally relevant practices, values, and a holistic approach. Children and families develop a sense of belonging and community when engaging in traditional practices, and cultural wisdom is honored and integrated into family life where children can thrive within their cultural context. And we're seeing really more and more research that is just tied to the success when culture is an aspect of prevention. And then as far as concrete goods are concerned, loss of income, material hardship, and housing instabilities are some of them among the most reliable predictors of child welfare system involvement. And here in Washington, we have an RCW that outlines that economic hardship alone should not lead to child welfare interventions unless there is a clear evidence of neglectful behavior that harms the child's well-being. So really looking as part of our plan how we can blend different funding streams to support areas of prevention that may not qualify under FFPSA as a Title 4E reimbursement program. I'm going to jump now back to Maureen and pass it off to just talk about some of now these implementation considerations as a lot of what goes into us now drafting and selecting what goes into our plan needs to be backed by some details that Maureen's going to go into.
Thank you, Jillian. It kind of sounded like you wanted to do this slide, but I'll give you a break.
Thanks.
Um, yeah. So we talked a little bit about what the 5-year prevention plan needs to include earlier. And then thinking about services and what kinds of prevention services specifically we want to add to the plan, we need to make sure that what we're putting in there we can actually implement. And so, um, we have to, in the plan, set out a roadmap of how we're going to implement the services and especially evaluate the services that we select. Depending on the service, we need to have, so when I mentioned those levels of evidentiary support earlier, well supported, supported, and promising, for each one of those levels, there's like a different degree of evaluation or continuous quality improvement that needs to happen. And so for each service, we need to be able to identify and lay out a plan for how we're going to evaluate whether we're actually achieving the outcomes that we set out to achieve. And some of those need like a pretty rigorous evaluation. Some services that are already well supported by evidence might only need like a CQI fidelity monitoring type of protocol. But either way, every single service that's in the plan needs to have its own evaluation plan laid out or CQI plan laid out. The plan also for services needs to have a description of how we selected the service. So that might be looking at data, identifying gaps in services for children and families statewide in certain communities. We might be able to glean some information. I shouldn't say that because we have gotten quite a bit of information actually from our community engagement sessions, which can inform different aspects of the plan that we need to write to for services such as cultural responsiveness, any adaptations that we want to include for services, any tailoring that we want to do. All of that stuff needs to be outlined in the plan as well for the specific services that we're putting in place. So those are just things, examples of things that we need to make sure we're thinking through. Now is the time to do that. Okay, so we also talked before about eligible populations, and I brought up the term candidacy. So each state needs to, or tribe needs to identify their eligible populations that fall under that candidacy label. And we have the opportunity now to take a look at what we originally said, again, 5 years ago, 6 years ago, when we were drafting this plan, and see, what might have changed. What do we want to add in here? What populations do we know more about now that we need to focus on? So we have up on the screen here a list of the populations that are currently in our plan. And these are, the different avenues that we can identify children or their families that need some or might need some prevention services. And you may notice by, scanning this list that right now, all of these eligible populations are families that are already known to DCYF. So these are children and families that are already involved with DCYF in some way. And these populations on the screen here will continue to be included in the plan, so we're not taking them out. But we do know that some populations and communities might be missing from this list. So again, I will turn it over to Jillian to take you through some new thinking about that.
And Jillian, I think you're going to also answer a question live that's in the chat before, and so I'm going to wait to move the next slide until you answer that question.
Yeah, sounds great. This is a question asked by Sarah about Medicaid reimbursement and how Title IV-E is the payer of last resort. So Maureen, if you want to jump into as I'm explaining this a little bit, you sure can. So yes, Title IV-E is the payer of last resort. And so if a family that is receiving services has Medicaid or another available payer, that would be what would pay first. And then if there is no coverage for that, which a lot of the services that are available for Title IV-E reimbursement, a lot of them are not actually reimbursable by Medicaid, then Title IV-E would reimburse. I do want to mention, though, that if there is an eligible individual that is receiving services that is being supported through administrative activities such as care coordination, case management, referrals, really everything that goes into that prevention plan to support that child or family. All of those activities are administrative and are child specific that can be reimbursable as well. And so really the opportunity for multiple systems working together to really leverage and braid those funds. Maureen, you also know the Title IV-E system quite well. If you want to jump in and add to any of those things that I just mentioned, I'll see if you have any additions.
I think that was great, Jillian. That would have been my answer as well.
Sounds good. And Sarah, if you have anything else specific, please, you can follow up with that as well. So now jumping a little bit to what really came up over and over again as we were talking to community about prevention services, and with the ability and Washington DCYF's desire to be able to put prevention services further upstream and into community through that community-based pathway that the Children's Bureau is now, approving. we really need to change our focus and change our language. And this really was, this also became very apparent as we were hearing about the terminology even around candidate for foster care, and our hopes to really shift this landscape. So moving from a crisis-driven response to really a strength-based response, and thinking further upstream when there are the first sign of needs, and being able to provide eligible services through Title IV-E prevention to those families where they're in community. And in order to do so, that really does take changing that focus from risk to need. And so we heard over and over again from the community that candidate for foster care language was felt harmful, or felt in a way like it made them more at risk to be identified in the future. And so I wanted to highlight really the encouragement behind the Children's Bureau. And that's that the Children's Bureau strongly believes working with families sooner through upfront primary prevention efforts is necessary to improve child welfare outcomes nationally. Committing to a broader continuum of prevention services that emphasizes primary prevention is contingent on a change of mindset and reorientation of what child welfare is intended to accomplish. Child protection will always be paramount and will always be needed, but the system can and should be designed to protect children by keeping families safe, healthy, and together whenever possible for remedial efforts, before remedial efforts become necessary. And to do so, that terminology and shifting away from candidate for foster care to eligibility based on prevention indicators. And so as we look to draft this plan, we've listened to that feedback, and we're focused on adopting a term such as prevention identifiers, even though we still have to go back and cite that federal law for the Title IV-E reimbursement. We really want to reimagine what this can be, and just use prevention identifiers to describe characteristics that may link individuals or families to factors known to increase the risk of child abuse or neglect. This new terminology that we really hope to emphasize is really aiming to focus on prevention rather than stigma, recognizing that these identifiers can be a starting point for support rather than a label of deficiency. So really changing that language and changing that mindset. And so what did we hear? These are highlights. Again, this is not everything that we heard from community, but highlights from participants during forums, poll questions during webinars, and feedback submitted online. And what we did as a team, as we were analyzing and looking at that, is we really focused on how can we put this into sections of identifiers. And so you can read some of the things on the slides, but really identifying what about a parent or caregiver could lead to needing prevention services to remove any risk of future abuse or neglect. Same thing with environmental identifiers, so things about the community that you may live in or the lack of services around you. family identifiers, domestic violence in the home, or instability in a family structure, maybe even parenting stress came up frequently. Cultural or societal factors. And this is something, recognizing the sovereignty of our tribal governments and letting tribes identify who they believe should be eligible. So identified by a tribe, or maybe even just having historical trauma and exposure in your home or your community. And then finally, those child specific identifiers. Maybe special needs of the child, or exposure to substances in utero, or having had other trauma or medical issues that the family is having to be supporting, can be something that maybe preventative services could lead to any future escalation of risks or needs in homes. So really, this is just a highlight of what we saw as and came up frequently within our engagement within community. So an additional slide that really doesn't focus on something that goes exactly into the plan, but we heard while we were in community and talking about gaps in our services, and if there was more opportunity for further services and supports, what are those needs, what are the themes. And so again, this is not in a ranking order by any way, but just some themes that were reoccurring as we were engaging with community. So funding, just the lack of maybe sustainable funding, or inequalities in distribution of funding, access to services. Some places, maybe there's service deserts, but other places, maybe just there's services, but extremely long wait lists. So access can't be made when it is most needed, or could be the most preventative in nature. Again, the need for more mental health and substance use services was reoccurring. Community collaboration and representation, just needing to work together on prevention to support our families, versus being siloed off. And then just the need of culturally representative advocates and outreach programs for minority communities. Cultural competency and sensitivity, really, again, highlighting the demand and need for culturally responsive services, and addressing language barriers that can improve access to services. All these things are just really important when we're trying to support our families when they need it most. Family support services, information and communication, systemic barriers and policy changes, prevention and early intervention, just lack of services aimed at preventing child abuse and neglect, especially for those early supports for childhood mental health and prenatal care. And then thinking again about that basic needs and supports, that concentration on that concrete goods, those things that can meet that those essentials like food, transportation, childcare, and things like that. So what does it kind of all mean together? What is that summary of what we heard? Here it is kind of laid out in some bullet points, but these themes underscore critical areas of focus, including the urgent need for funding and resource allocation, improved access to services, and community collaboration. addressing mental health and substance abuse services, enhancing cultural competency, and ensuring that families receive the support they need are essential for community well-being. Efforts towards prevention, training, and overcoming systemic barriers will also be vital in fostering a more effective service delivery framework. And so just recognizing too that family first is not going to be the end all be all when it comes to prevention. It's definitely just an area of funding and availability that we can access, but it's essential that we leverage it as much as we can, and we collaborate together, and we can see how we can utilize family first to its largest potential as we really build a prevention landscape and continuum through Washington. And then in the next slide, I just wanted to talk a little bit about ICWA and active efforts for this next plan. We again will be hosting a listening session October 28th, where we'll talk a little bit more about this with a tribal specific listening session. But we've also, as we've been collaborating with our communities, we've been hosting a series of advisory committee meetings and tribal roundtables in an effort to really grow our collaboration with our tribal partners when it comes to the ability to expand prevention services for our tribes through Washington. Not only for what is available through our Title IV-E plan for services when there's DCYF involvement, but really thinking about what tribes can do for their own prevention service array within their tribal community. So Washington is really committed to meeting the unique needs of American Indian and Alaska Native children and families by ensuring that services are provided in a manner consistent with ICW, the Indian Child Welfare Act. American Indian and Alaska Native children may be provided prevention services either by a tribal Title IV-E prevention program through a Title IV-E agreement. Again, and a Title IV-E agreement needs to be in place, or with DCYF through our services that DCYF can refer to included in the prevention plan. Prevention services provided by a referral to Alaska Native and American Indian children under Title IV-E prevention really closely are intertwined with the requirements of ICWA that must be maintained to maintain an Indian child with their family. And so in doing so, we're really aligning the work that has been done through tribal collaboration with the drafting of a new ICWA policy here in Washington, and then also the active efforts that are included. So I wanted to just really highlight a definition that was recently established around active efforts, and that means affirmative active through thorough, complete, and timely efforts intended primarily to maintain or reunite children who are or may be Indian children with parents, Indian custodians, or legal guardians. And then again, highlighting some of those standards that will go into the active efforts and including that in our prevention plan for the next 5 years. Something that really just will align what is happening in the field around ICWA and active efforts to our prevention plan. So I'm going to now pass it to Phyllis to take it from here to discuss the community-based pathway in further detail.
Thank you, Jillian. So there has been a lot of interest in what does this look like in community. And so because we've heard a lot from those that we've been meeting with in the town halls and the collaborative forums, we really are definitely in a solid place to submit to the Children's Bureau our interest in having a community pathway. And it's really intended to provide support to those families so that they don't have to have child welfare involvement. Um, Currently, the way that things work is that families need to have an open child welfare case. And we believe that one of the best ways that we can do this work is in community upstream and with those providers who are interested in providing those services that are outlined in our Family First Plan and that families are able to go to for trusted support and services. And so to do so, we want to engage Washington communities and our lived experts and what it means to design that pathway. I don't know, can I advance the slides? There we go. So in order to do this, we are looking at some of the current existing possibilities about who would provide the services and case management that's necessary as part of this work. We currently are working with some contracted community-based agencies who are doing amazing things. So there's nonprofit agencies out there already. There's also family resource centers. We're going to be exploring how do we mobilize and expand the work that's happening in FRCs because families see them as a trusted resource. Oftentimes they go to them for concrete goods, which is part of services, but just imagine what it could look like if there was more that families could stop in for and participate in and feel like they were supported in being able to receive those services. Jillian also mentioned the culturally responsive specific services. We are working with Arrayos in the Seattle area to provide services as part of a pilot for American Indian, Native American families. And we're really excited about that possibility and hope to have some good information after that pilot is done to see what we can do for spread as well as having services included in our Family First Plan. Some of those services that we currently have on our plan are like parents as teachers and home builders and safe care. Those are services that the department has been providing for families and with families. And then looking at the use of those particular EBPs, we feel like continuing to offer those is going to be really important. And it's very specific and it's something that families are going to be able to access. We're also looking to, and this speaks to some of that, like how do we get involved and how are you going to select providers? We want to look at non-child welfare public agencies and smaller agencies as well that are part of the folks that families would be interacting with. It could be for behavioral health. It could be for public assistance. It could be for housing. Like we want to be able to connect with those agencies and with those systems in order to really create a way for families to get what they need as well as when they need. The other part about these services is that I don't think I can advance the slides. Thank you. In order to do this, we are looking at being in community and with community, being able to hear what's needed. Just as we held collaborative forums and town halls to understand and hear from those who are working with and or are receiving those services, we want to engage some listening sessions that go much deeper. The thought is that we'll start in January 2025, and we'll do those during the first quarter, both in person and virtually. because this work can't be done without understanding the lived experts as well as who they identify as those trusted entities. We're also looking at doing a community partner virtual survey, which is how is it that we know about you and you know about this work. We'll continue to provide information as well as seeking input from those in community. We have a couple teams that we're working with across not only in our partnership prevention and services, but in the Help Me Grow and other early learning. We really are working to integrate and communicate and do better at this work because we don't want to send families to multiple different locations or to different people. We dream big in this work for Family First, and we really want to ensure that we are engaging it the right way with the right people. And that's big and small. Small communities know a whole lot more about what they need than we do sitting in Olympia. And so we want to be able to hear that. I also think about, we are working with our plan of safe care folks with those birthing hospitals and those referral processes. We're learning so much about that and how that can apply into the community pathway work. I had mentioned the FRC work. There's also a current pilot with Family Reconciliation Services. And that pilot is funded by a philanthropic organization and in partnership with the department so that we can have a better idea as well of what those referral pathways look like, what does reporting look like, and what's required so that when we are able to build out and support community pathways in Washington State, we'll have had some lessons learned that we can really build out and support the work that's needed.
I think this is Maureen who's going to wrap us
Yes,
up for today.
thank
Yeah,
you.
it's like I'm handing it over to Maureen. So.
Yep. Thanks, Phyllis. Okay, so where are we at now in our process? We are analyzing input from all of the engagement efforts, including the feedback that we will get today or have gotten today already, developing the plan. Then the draft of the 5-year prevention plan will be posted for public comment. And I think somebody from DCY, please correct me if I'm wrong, but I believe that the public comment period is currently planned for the end of November. Perfect. And then after it goes through final review, we'll be wanting to submit it to the Federal Children's Bureau by the end of 2024. Okay, so then I'm just going to leave this slide here for a minute while I say thank you, but we've got a feedback survey. So if you want to use the QR code or eventually when this presentation is posted, you could click on the link. But there is a feedback survey. The feedback survey is not so much, did you enjoy today's presentation, so much as it is, do you have feedback about the plan? Are we missing things? Are there big things we've missed when we've been talking about services today or populations? Do you have some burning questions? That kind of thing. So please fill out that survey if you have any thoughts or questions leaving today's meeting. And then there will be a public notice coming soon to the FFPSA webpage. I assume that public notice is for the public review, public comment period. So yeah, so with that, I will say thank you and I'll let Jillian close us out.
Well, I don't know if I need to close us out. I think Sarah is, but I want to say thank you. And I also want to just mention for those of you that might not have access to do the QR code, you can go to our website and you can find the exact same link for the feedback. And you are also welcome to email us back at that same email that you received your registration link for today's event. So couple different ways that you can get feedback to us if you can't use that QR code.
And I think that's a great reminder, Jillian, that a lot of information can be found, just not in relation to the conversations that have happened so far or the development of the plan, but really accessing that public website. If you have questions about Family First, if you have questions about EBPs that are on the clearinghouse and what they're ranked, definitely want to utilize that public website as a great source of information as you move forward. So I am just going to be repetitive in what you've heard from my peers today, that we really appreciate the time that you took to listen to all the information that was provided to you today. We encourage you to look at the information when it's posted on the public website, share it with your peers. We really encourage you to be the champions to help spread the word and information across the state of Washington, so that you really have a plan that reflects the community and the variances that are really evident across the broad state of Washington. So thank you so much, everyone, for your time, and we hope you have a great rest of the day.